Hello, welcome to Code Rhetoric with Tam Talk. Hi, my name is Tamara Abraham, founder of Abraham Medical Coding Coach LLC. In this segment, we'll be focusing on Chapter 6, Diseases of the Nervous System, which can be located in Section I, Letter C, Number 6A. The ICD-10-CM Guidelines states that codes from Category G81, which represents the hemiplegia and hemiparesis, and subcategories G83.1, monoplegia of lower limb, G83.2, which is the monoplegia of the upper limb, and G83.3, which represents the monoplegia unspecified, identify whether the dominant or non-dominant side is affected. Should the affected side be documented but not specified as dominant or non-dominant, and the classification system does not indicate a default, the code selection is as follows. For our ambidextrous patients, the default should be dominant. If the left side is affected, the default is non-dominant, and if the right side is affected, the default is dominant. So in our first coding example, the patient is diagnosed with congenital hemiplegia. So if we follow our book steps, we're going to go to our main term located in the index, which is hemiplegia and congenital. So again, hemiplegia is the main term and congenital describes the type of hemiplegia. Our ICD-10-CM code should be G80.8, which represents other cerebral palsy or mixed cerebral palsy syndromes. Our rationale for this is, again, congenital hemiplegia is a specified type of hemiplegia. Our code doesn't specify whether it is a left or right, or whether it's dominant versus non-dominant. So when referencing the tabular list, or when we refer to the tabular list, the diagnosis is already coded to the highest specificity. So therefore, ICD-10 code G80.8 is the correct code. So in coding example number 2, our patient is diagnosed with spastic hemiplegia on the right side. So again, as we follow our book steps, we're going to go to our main term in the index section of our ICD-10 book and locate hemiplegia. And again, because the physician or provider specified that the patient had spastic hemiplegia, we're going to drill down to spastic. When we locate the code in our ICD-10 book, it should represent G81.1. However, there is a space or a digit holder located after 1. At this point, we are to refer to our tabular list or proceed to our tabular list for additional coding guidelines. So once we refer to our tabular list, our ICD-10 code should be G81.11, which represents the spastic hemiplegia affecting the right dominant side. So our rationale for this, again, the spastic hemiplegia is affecting the right side. And per coding guideline, the right side is considered the dominant side when documentation doesn't specify if it is dominant or if it's non-dominant. Therefore, we are to assign the number 1 as the 5th digit to complete the coding. So again, our ICD-10 code, or our final ICD-10 code for this diagnosis, should be G81.11. So in our third and final coding example, the patient is diagnosed with spastic hemiplegia on the left side, and it is also considered the non-dominant. So again, we're going to follow along in our ICD-10 index listing and locate our main term, which is hemiplegia, and then we're going to drill down to spastic. So again, our ICD-10 code gives us or provides us to G81.1, again with the empty space holder. So once we proceed to our tabular list for the additional coding guidance, our ICD-10 code should be G81.12. Again, that's represents spastic hemiplegia affecting the left non-dominant side. And our rationale, again, spastic hemiplegia is affecting the left non-dominant side. One, because our provider did specify whether the hemiplegia was dominant versus non-dominant. And also, per the coding guideline, the left side is considered to be the non-dominant side. Therefore, we are to assign the number 2 as the 5th digit to complete coding. So again, our final ICD-10 code should be G81.12. In our coding tips, we must first pay close attention to the dominant versus non-dominant documentation, as well as the status, the listing, and the ordering of diagnosis, excuse me. So what I mean by ordering is how the doctor lists the diagnosis. Again, because there are guidelines that specify how diagnosis should be coded or listed based upon the ordering of those diagnoses. And you also want to pay close attention to whether or not the doctor specifies the left or the right. Number 2, you want to always reference your tabular list to confirm if an ICD-10 code requires additional digits or placeholders in order to complete the coding. Remember to code to the highest specificity, and as always, when in doubt, always reference your coding guidelines.